Good morning, and welcome to this MassAHU presentation of understanding where, when, and how HSAs and Medicare intersect. The Mass Association of Health Underwriters presents programs like this monthly to its members. This time we decided to open it up to the general public because of the nature of this topic and how difficult it is for many people to grasp. For more information on MassAHU, please log on to www.massahu.org. My name is Bill Stewart. I am Director of Strategy and Compliance at Benefit Strategies, an independent third-party administrator that administers various reimbursement accounts. I'm also the author of an upcoming book. It'll be published in January 2019, entitled The Tax Perfect Retirement Account, Using HSAs to Build Medical Equity. And today's presentation is based on some of the concepts presented in that book. If you want more information or if you want a copy of the slides for today, please email me at wstewart@benstrat.com. For subject matter, please put MassAHU, and I'll be sure to get you the slides and answer any other questions that you have. Our agenda. We'll start by talking about HSA rules. So what are the health savings accounts rules and how do they begin to intersect with Medicare? Then we'll talk about some Medicare rules. This is not a comprehensive program on Medicare, but we do talk about the various places where the Medicare rules intersect with HSAs. We'll talk about some self-remedies. In situations where eligibility is compromised for HSAs, how can people take care of that themselves? And then we'll talk about legislative relief, some proposals out there that may make this somewhat easier. Finally, we'll talk very briefly about HSAs as a retirement account. I am very passionate in believing that HSAs are the absolute best retirement account that anybody can possibly have due to superior tax advantages over IRAs, 401ks, and 403bs. And we'll talk really briefly and go through an example of how that works. HSA rules. Individuals must meet certain criteria in order to open and contribute to an HSA. First off, they have to be covered by an HSA qualified medical plan. And that plan simply has a minimum deductible, a maximum out-of-pocket, and requires that all non-preventive services be subject to an upfront deductible. That deductible for 2018 and 2019 is $1,350 if you cover only yourself, what we call self-only coverage, and is $2,700 if you have family coverage. Now, family coverage may be talked about as family, employee plus spouse, employee plus one, employee plus child. What matters is if the contract has two or more people on it, regardless of what the insurer or the employer calls it, it's a family contract and it must be a minimum deductible of $2,700. Also, you cannot qualify as somebody else's tax dependent. So for example, I have two children who are still in college. They're enrolled in my HSA qualified plan. They can't open their own HSA because they remain my tax dependent. And finally, and most important, you can't be enrolled in disqualifying coverage. And we'll talk about that on the next slide. The most important piece we need to understand here is that all parts of Medicare are disqualifying coverage. If you're enrolled in Part A or Part B or Parts A, B, and D, or a Medicare Advantage plan, Medicare Part C, you are no longer HSA eligible. And the reason for that is Medicare does not offer an option that has a minimum deductible of at least $1,350. Those of you familiar with Medicare know that Part A has a deductible of $1,340. It's very close. Parts B and D also have separate, much lower deductibles. So if you have coverage on any part of Medicare, you are disqualified from opening and contributing to an HSA. What does that mean? If you don't have an HSA already, it's too late to open one. If you do have one, you can no longer make pre-tax payroll contributions into that HSA. You also cannot accept employer contributions into that either. So if you're age 66, 67, you're working aged, you're still enrolled in the group medical plan, you're also enrolled in Medicare, you're disqualified from putting more money in or accepting an employer contribution. You can continue to reimburse expenses tax-free when you're no longer HSA eligible. But when you enroll in Medicare, what you're doing in effect is you're shutting the door on contributions to your HSA going forward. Medicare offers individual policies only. So when I enroll in Medicare, I will enroll in Medicare Part A or Part A and Part B. That will cover only me. When my wife is qualified to enroll in Medicare, she will have her own separate policy. So Medicare offers only individual policies. And the reason that's important in the context of HSAs is simply one family member may be disqualified because of enrollment in Medicare, but another may not. And we'll go through a couple of examples of that in just a minute. And if that's the case, so if my wife and I are both enrolled in the group plan and she's enrolled in Medicare and I'm not, I'm still HSA eligible, I can still contribute up to the family maximum because I have a two-person contract, even though only one of us is HSA eligible. So I can contribute $6,900 in 2018, $7,000 in 2019, and each year I can put in an extra $1,000. If my wife is enrolled in Medicare, she can do none of that. Distributions from an HSA for qualified expenses are always tax-free. And what are qualified expenses? Well, they are medical plan and Medicare cost sharing. Also qualified medical, dental, vision, and over-the-counter expenses, including some things that medical plans don't cover. For example, foot orthotics, hearing aids. Many plans still don't cover acupuncture. Those are still qualified expenses that you can reimburse tax-free from your HSA. Dental expenses, virtually anything except teeth whitening, which is considered cosmetic. So fillings, whether it's silver fillings or the new fillings that are designed to match the color of the tooth, crowns, bridges, implants, orthodontics, those are all HSA qualified expenses. Vision expenses include contact lenses and solution, bifocals, trifocals, prescription sunglasses, virtually anything you can buy at the optician except non-prescription sunglasses. And then over-the-counter items, over-the-counter drugs and medicine with a prescription, as well as over-the-counter drugs and over-the-counter equipment and supplies without a prescription. You can also cover your Part A premiums through an HSA, tax-free. Now, most of us are paying our Part A premium during our working years as part of the FICA tax, and we will not be subject to a Part A premium. But if we don't qualify for our premium-free Part A, we can reimburse those expenses out of our HSA tax-free. Also, Part B premiums. The Part B premium in 2018 is $134 per month, standard premium. It can go as high as $428 a month, depending on income. You can reimburse that tax-free out of your HSA. Part D premiums. So Part D covers prescription drugs. The average premium nationally in 2019 for Part D is $35.02. So whether your plan is $15 or $75 a month, you can reimburse those premiums out of your HSA tax-free as well. Also, Medicare Advantage premiums. So if you decide rather than going on traditional Medicare, you want to go on a managed Medicare Advantage plan, you can do that, and all your premiums are tax-free there as well. But what is not tax-free is a Medicare supplement plan. In some states you hear those called MedX plan, but the plans that fill in the financial gaps that are bought from a private company, those premiums cannot be reimbursed tax-free from an HSA. And the asterisk next to some of these simply means that an HSA owner cannot reimburse those expenses until the owner himself turns age 65. So if my wife is on Medicare today and I'm not, I'm age 63 and she's age 67, I can reimburse her Medicare cost sharing, her dental, her vision expenses, but I can't reimburse her premiums until I myself turn age 65. When I turn 65, I can start reimbursing her premiums tax-free from my HSA. Let's go through a couple of examples. Rob remains active at work at age 67. He covers his wife Laura, age 62, and himself on his employer's HSA qualified plan. He enrolled in Part A at age 65. So Rob is what we call a working senior. And the intersections we're talking about today are primarily around working seniors, people age 65 or older who continue to work, remain covered by their employer's plan, but they or a family member are also enrolled in Medicare. So in this situation, Rob is not HSA eligible. He's enrolled in Part A, that is disqualifying coverage. His wife Laura is not enrolled in Medicare. She's only age 63 and she's not disabled, so her only coverage is Rob's employer's medical plan. So Laura, assuming she meets the other HSA eligibility criteria, can open her own HSA, and she can put in up to $6,900 this year, $7,000 next year, 2019, plus the additional $1,000 catch-up contribution each year. She can reimburse not only her own qualified expenses, but also Rob's. Even though Rob is no longer eligible to contribute to his HSA, Laura can reimburse his expenses because she's legally married to him. She can reimburse her own, her spouse's, and her tax dependents' qualified expenses. And Rob, as her spouse, his expenses can be reimbursed, everything except his Medicare premiums. Example number 2 is Jerry, a retired dentist, next door neighbor of Rob and Laura. He is enrolled in Medicare. His wife is not yet eligible for Medicare, so she's enrolled in self-only coverage, an HSA qualified plan, that she purchased directly from an insurer or through an ACA exchange. So Millie has self-only coverage. She is HSA eligible. She can contribute up to the self-only limit. Because remember, her husband is not on her policy. It's a one-person policy. She can contribute $3,450 in 2018, and then $3,500 in 2019, plus an additional $1,000 catch-up each year because she's over the age of 55. And again, she can reimburse her own as well as her husband Jerry's qualified expenses, everything except his Medicare premiums, because he is her husband. One final example. John, age 66, is enrolled in Medicare. His wife Maureen is only 63. She's enrolled on her employer's medical plan, which covers their 3 dependent children as well. So John has his own coverage, and then Maureen and the kids are on separate coverage. Maureen owns an HSA with a $27,500 balance. She can reimburse her own, John's, and the kids' qualified expenses, as long as they're her tax dependents, tax-free from her HSA. She again can't reimburse John's Medicare premiums because she herself is not age 65. This works even if Maureen's coverage is not HSA qualified. She could be enrolled in a first dollar HMO, but she established an HSA and funded it years ago, has $27,500 in it. She can't put any more in because she's no longer covered by an HSA qualified plan. She can still reimburse everybody's expenses tax-free. Next section, we're now going to switch to Medicare rules. Again, not an exhaustive study of Medicare, but we're going to look at those specific areas of Medicare that are going to intersect with HSAs. Medicare basics. Let's start with this. Individuals are entitled to receive Medicare benefits beginning at age 65, but they're not automatically enrolled in Medicare. There are 2 ways of enrolling in Medicare. One is to start collecting Social Security or railroad retirement benefits. If you do that before age 65, at age 65 you'll automatically be enrolled in Medicare Part A and Part B. You can waive Part B, but you cannot waive Part A if you're receiving Social Security or railroad retirement benefits. The other way of enrolling is to positively enroll, to actually sign up for Medicare. Those are the only two ways of doing it. Turning age 65 does not magically enroll you in Medicare unless you're collecting Social Security or railroad retirement benefits. This is one of the most common misnomers that too many people have out there, that at age 65 they'll be auto-enrolled in Medicare. And again, they will not unless they're collecting Social Security or railroad retirement. As long as they're not collecting those retirement benefits, they will never be enrolled in Medicare until they themselves positively fill out an application and submit that. Medicare secondary payer. This is a very complex topic that I'm boiling down to a couple of key points. Anytime you're covered by more than one coverage, whether it's a group plan and Medicare, whether it is husbands and wives covering each other on their medical plans, whenever you have two different coverages, one of them has to be primary and one has to be secondary. So one of them has to have the claim submitted to it first. It adjudicates that claim, sends the information back, and then that information is sent to the second payer to find out whether that second payer owes anything else. The secondary payer usually pays little or nothing. The primary payer is the one that bears the bulk of the cost of any claim. So when individuals are enrolled in both private coverage, so a working senior continuing on the group plan, and also enrolled in, let's say, Medicare Part A, then we have to determine which one is primary and which one is secondary. And Medicare sets those rules. If the employer has 20 or more employees, the group plan is primary and Medicare is secondary. That means a provider is going to send the claim first to Blue Cross or Anthem or Harvard Pilgrim, whatever insurer. That insurer is going to say, we see the claim, we owe this much. Send that information back to the member and the provider. The provider then sends that explanation on to Medicare, and Medicare will pay little or nothing for that. So that's the way it works when the group has 20 or more employees. When there are fewer than 20, Medicare is primary, and the group plan is secondary. So the claim is going to go to Medicare first, and then only if the member has some remaining financial responsibility, and she almost always will the claim then go to the group plan as the secondary payer. What's important here is that if the group is under 20 and Medicare is primary, the insurer, the private insurer, may require that that individual enroll in Part A and Part B. So I'm a working senior, I'm just turned age 65, I'm going to continue on the group plan. I don't want to enroll in Medicare. I love my group plan. My company has only 7 people. The carrier, my employer's carrier, can say to me, you have to enroll in Part A and Part B because they are primary. We are not going to be the primary claim payer just because you chose not to enroll in Medicare, which would have been primary. This is not a federal government rule. It's not a state rule. It varies by insurer. So it's very important for employers and brokers to understand the policy of each insurer in their market. In the Massachusetts market, for example, some of the insurers do require enrollment in Part A and Part B. Some do not. It makes a big difference in small companies when working seniors want to continue to participate in an HSA program. If they're enrolled in any other coverage, traditional HMO, traditional PPO, this does not impact them at all. It's only when they have an HSA qualified plan do they care about this, because enrolling in Medicare disqualifies them from an HSA, but not from receiving benefits from that other plan. Let's take a couple of examples. Ernie is age 66. He tends bar at a small pub in Boston. He's enrolled in the group plan that is a $1,000 deductible. So Ernie, it's not obviously not an HSA qualified plan, but it could be a $1,500 deductible. Doesn't matter for the purposes of this example. His group carrier requires him to enroll in Part A and Part B. But Ernie is a very independent or not too bright guy, and he says, no, I'm not going to enroll in Medicare. I want only the group coverage. That's fine until Ernie goes into the hospital and incurs a $35,000 bill. That bill is going to go to Medicare first. It would normally go to Medicare first, but Ernie doesn't have Medicare. So that bill goes directly to the group carrier. And the group carrier says, we are going to reimburse only what a secondary carrier would reimburse there. So it's going to reimburse virtually nothing. Medicare would have reimbursed everything after $1,340 Part A deductible, but now Ernie's responsible for all of that, $1,340 up to $35,000. His other plan, his group plan, is a $1,000 deductible, so Ernie's responsible for the first $1,000. And the only part of that bill that the group plan is going to pay is between $1,000 and $1,340. So Ernie's left with a bill of more than $33,000 because he chose not to enroll in Medicare, Part A and Part B, as his insurer required. Medicare and penalties. It's important to understand at a very high level what the penalties are for Medicare, because many people are prompted to enroll in Medicare at age 65 because they've heard horror stories about the potential penalties that they could incur if they delay enrollment. The fear of possibly having penalties is real. In practical terms, very few people are going to run up against those. But let's look at who they are. So Part A. Part A has no penalty if you've worked at least 40 quarters and you delay enrollment after age 65, because there's no premium, so there's no penalty to attach a premium to. The penalties are simply surcharges on premium, and most people will never pay a Part A premium. For those who do and delay enrollment after age 65 and they don't have group coverage, it's a very important point, then they'll pay a penalty. So if I defer my Medicare enrollment until age 68 and I continue to work up until that point, I can transition from my group coverage directly to Medicare without a gap in coverage and without the prospect of any penalty. But if I retire at age 65 and go without insurance for 2 or 3 years because I'm feeling healthy and I don't want to spend the money, then when I do enroll later, I will be subject to a penalty. Part B, same thing. As long as you transition directly from group coverage onto Part B, you will never face a penalty. You will face a penalty if you have a gap of non-coverage after age 65. And the penalty for Part B is for every 12 months that you don't have group coverage after age 65, you'll be assessed a penalty of 10%. So it's 10% for every 12-month period. So if I went without insurance for 3 years after I was first eligible for Part B and I later enroll, I would pay a 30% surcharge on my premium for the rest of my life. Now 30% is a big charge. But don't forget, as long as I go directly from a group plan to Medicare, I will never pay the penalty. The penalties on Part A and Part B are most likely to be paid in a scenario in which the husband turns age 65 and he enrolls in Medicare, retires, and drops his group coverage. His wife is a year younger. His wife picks up COBRA for her to cover the 12 months up until she is eligible to enroll in Medicare. Under current law, COBRA is not considered group coverage. So in that scenario, if the wife at age 65, when she's first eligible for Medicare, enrolls, she's okay. If she continues the COBRA a little bit longer or has other coverage a little bit longer that's not group coverage, when she does finally enroll in Part B, she will be subject to penalties. Part D penalties are completely different. The Part A and Part B were written into law in 1965. Part D was written in 2003, and it follows a completely different set of rules and entirely different logic. Under Part B, it doesn't matter whether you have group coverage or not after age 65. What Medicare is looking for is the quality of your coverage. If your coverage is at least as rich as a Medicare Part D plan, then you're okay. You can continue on your group plan till age 67, 68, 69, and then you enroll directly into Part D, you will face no penalty. But if that coverage after age 65 is less than what Part D would have paid, then you have non-Medicare creditable coverage. And for every month of that coverage, you will pay a permanent surcharge of 1% of the premium for the rest of your life. So again, if for 10 months you do not have MCC coverage and then you enroll, you'll face a 10% surcharge for the rest of your life. But the surcharge is not attached to your premium for Part D, but rather the national average, which, as I mentioned earlier, is just over $35 in 2019. So those are the penalties. You'll rarely find them in Part A or Part B. The usual situation is COBRA. As long as you have group coverage after age 65, no Part A, no Part B penalties when you transition right from the group plan to Medicare. But Part D, they're looking at the quality of the coverage. And the issue here for HSA people is it is not uncommon for an HSA qualified plan with a deductible of $2,000 or more to fail the MCC test. So you can be covered by a plan. My plan at work is a $3,000 self-only, $6,000 family deductible. It's an HSA qualified plan. If I continue that plan after age 65, I will not have MCC coverage. So I have a choice at age 65 of scrapping my employer plan and enrolling in Medicare with no penalties, or continuing on my group plan, continuing to contribute to my HSA, realizing that every month that I do that, I'm going to incur a 1% surcharge on my premium for Part D for the rest of my life. Let's give a quick example. Jim is a New York City taxi driver. He retires on his 67th birthday. He moves right from the group plan to Medicare. His RX rider was not Medicare creditable coverage since he turned age 65. He has no Part A penalty because he transitioned right from group coverage to Medicare. He has no Part B penalty. Again, he transitioned right from group coverage to Medicare. Part D, even though he went right from group coverage to Medicare, that's not the criterion we use to assess Part D penalties. So in this case, Jim had 24 months of group coverage, non-MCC, before he enrolled in Part D. So he will face a 24% penalty for the rest of his life. In 2019, that's $850 per month, or about $100 per year extra that he's going to have to pay by delaying enrollment for 2 years. And as the Part D premium changes in the future, the amount of that penalty will change because it's based on a percentage. The last 2 years, Part D premiums have actually gone down, but I wouldn't count on that for the future. So Jim probably will be paying a little more than $100 each succeeding year that he has Part D coverage. So was it worth it to Jim? He's going to pay an extra $100+ per year the rest of his life for his Part D premium. On the other hand, 2 years of self-only coverage, he was able to sock aside about $9,000 extra in his HSA. That's a personal preference. Jim was either ignorant of the rules or was very conscious and chose the $9,000 of reduced taxable income and $9,000 in his HSA were more valuable than the potential $100+ penalty he'd pay a year for the rest of his life. So, how can you correct some of these issues? The HSA rules say one thing, the Medicare rules say something else. This is Department of Treasury and IRS. This is Department of HHS and CMS. They don't talk to each other. So the rules are not integrated, which makes it very difficult for individuals who are working past the age of 65. What can they do? There are a couple of ways of getting around this, but they're not easy. The first is to disenroll from Medicare. The second is to disenroll from Social Security if you're receiving Social Security. So let's talk about these remedies. It's possible to disenroll from Medicare. Not many people do it, but there is a process that allows you to do it. What you have to do is you repay all the benefits you've received from Medicare up to that point. So if you're age 66, 67, 68, you're fairly healthy, and you continued on your group plan, and that was primary payer, Medicare's probably paid very little in benefits to you. It may make sense for you to disenroll from Medicare in order to participate in an employer's HSA program. If you're choosing any other employer coverage besides an HSA, there's no harm in having Part A. But if you want to contribute to an HSA, accept employer contributions, you need to disenroll from Medicare, and you can do that. The HSA program may be attractive to this person because it has lower premium, the person's a higher income earner, or attractive employer contribution. So scenario is you're age 67, your employer introduces an HSA plan for the first time, you want to be in it, the employer covers half the deductible, it's a lower premium than any other plan you have, you want to reduce your taxable income, you would have to disenroll from Medicare in order to do so. Disenrolling from Social Security is also possible, but it's almost cost prohibitive. What I understand, there are between 75 and 150 people per year across the country who disenroll from Social Security. And most of them aren't doing it for HSA purposes. They're doing it to lock in a higher Social Security payment when they do reapply for benefits. So in order to do this, you need to repay all the Medicare benefits, also all of your Social Security benefits. So the Medicare benefits may be minuscule if Medicare is a secondary payer, but your Social Security benefits are real. That monthly check, everything you've received would need to be returned to the federal government. And so typically it's not going to make sense for anybody who's receiving Social Security to disenroll from Social Security and Medicare in order to gain a few years of HSA eligibility. Let's look at a quick example. Walter's employer introduces an HSA program. Walter is a working senior. The company suddenly introduces this new program. He says, I'm going to disenroll from Medicare to participate. He received no Medicare benefits, or very little, so that's not a big deal. But he also was enrolled in Social Security. So he now has to pay back 24 months of Social Security payments at $1,500 a month, or $36,000 he's got to come up with to return to Social Security, to disenroll from that as of age 65. He puts $24,000 in his HSA over a period of 3 years. He's got a family contract. He covers himself and his wife, about $8,000 each year between the maximum contribution and his catch-up. So he put in an extra $24,000. He saves about $7,500 in taxes. So there's a tax benefit associated with this. But he forgoes $54,000 in Social Security benefits during that time. It doesn't make sense financially. He will, however, see future Social Security benefits increase by about 30% because he disenrolled and now he's re-enrolling after his full retirement age. Therefore, his Social Security benefits go up. But in no way are the extra Social Security benefits and the tax benefits of an HSA contribution ever going to reimburse him for that $36,000 check he had to pay unless he lives a very, very long life. Legislative relief. So we just talked about the two ways that individuals can get back to HSA eligibility after they've enrolled in Medicare or Social Security or both. What are the legislative remedies that might help this in the future? The problem is that Medicare rules discriminate against many working seniors who want to contribute to an HSA. And this is a message that I have spent time delivering in Washington, D.C. We get a receptive audience, but we really have attacked this problem only a little bit so far, and that's only in proposed legislation. The problem is these rules discriminate against working seniors based on income, and they discriminate against working seniors based on their company size. And we're going to see how this interplays in the next couple of examples. We have Dorothy, who's age 67. She continues to work. She earns $60,000 a year, CFO of a large retailer. So her employer has more than 20 employees. So that tells us that Medicare would be secondary coverage. So her insurers is not requiring her to enroll in Medicare Part A or Part B. So she remains in the company's HSA program. She doesn't have to enroll in any part of Medicare under federal law. Her insurer is not requiring it. She can receive her employer's $1,500 contribution toward her deductible. So her employer is covering half the employee's deductible. She gets to keep that money, put that money into her HSA, and she can contribute an additional almost $3,000 of her own money into the HSA. So she's able to reduce her taxable income and accept the employer contribution. So very good financial deal for Dorothy. Her coworker Blanche is the same age and works for the same company, but Blanche is not a CFO. Blanche is a clerk, and she makes $22,000 a year, which is not enough for Blanche to live on. So she started collecting Social Security benefits at age 65. She needed to supplement her income. So she's covered on the same group policy because that's the only one the employer offers, but now she had to have enrolled in Part A. She's no longer HSA eligible. She can't receive the $1,500 employer contribution. So Dorothy has a net deductible of $1,500. Blanche has a net deductible of $3,000. Blanche also can't reduce her taxable income by making contributions into her HSA. So discrimination here based on the group size. They're the same age, but because of the way the Medicare rules work, unfair to Blanche. And we have finally a third person, a third roommate of theirs, in fact, named Rose. She's age 67. She earns $60,000, and she has a 10-employee retailer, so a small company, but same age as the other two, earns as much as Dorothy, but she works for a small company. She's covered on her employer's HSA qualified plan, only coverage the employer offers. Her insurer requires her to enroll in Part A and Part B. So she has to enroll in Part A and Part B, or she has to accept the full financial responsibility of Medicare, which she's clearly not in a position to do. She can't receive her employer's contribution, and she can't contribute to an HSA either. So the first example we saw between Dorothy and Blanche, discrimination based on income. Here we see discrimination between Dorothy and Rose based on nothing more than the size of the group. Otherwise, the two of them are identical. So here's just a graphic showing you that. Dorothy and Blanche, 20-plus employees, different incomes, one enrolled in Social Security, one not, one eligible to contribute and receive an employer contribution, one not. Rose, very similar situation to Dorothy, but her insurer requires her to enroll in Medicare, therefore no HSA for her, no employer contribution, no pre-tax payroll contributions. This is the situation that I've been working to try to correct in Washington. Current legislative remedy. There is a bill that was passed by the House of Representatives in late July of this year. It's now at the Senate Finance Committee, where I don't expect it to come out of committee the rest of this year, which would mean the bill would expire, unfortunately. That bill has a provision that says if you enroll in Part A, that will not be considered disqualifying coverage for HSA eligibility. So that's a good law as far as it goes. That would help Blanche, because Blanche, by collecting Social Security, is forced to enroll in Part A and Part B under federal law. She can waive Part B, And most working seniors will waive Part B if they're covered by the group plan because they'd be paying a premium otherwise for very little benefit. She can't get out of Part A, but that's okay. It's not okay today because that disqualifies her. This new legislation would tell Blanche you can enroll in Part A, continue to collect your Social Security. You'd also be eligible to participate in the HSA program, to receive the employer contribution, and to make contributions on your own. So this solves the discrimination based on income. It does not, however, do anything to mitigate the issue that Rose had, because Rose's insurer requires her to enroll in Part A and Part B because that way the insurer will be secondary. So this bill will not help Rose. She could waive Part B if she worked at a larger company and still be HSA eligible. Smaller company, the insurer's requiring A and B. This bill is not going to help her. Recommended legislative remedy. So what I'm advocating is simply the same bill, but we allow enrollment in Part A and Part B not to be disqualifying coverage. So that way, Rose would be able to fully participate in an HSA program. And the legislation gets a little complex about who's primary and who's secondary at what point, but Medicare would be the primary payer after the group plan deductible, as it is today, and someone would be allowed to be enrolled in Part A and Part B, continue to contribute to their HSA, and Medicare actually gets a break below the deductible in payments, and above the deductible it will assume its regular responsibility. The other important piece of legislation, the other important issue that we're trying to correct is the 6-month retro rule. Those of you who studied Medicare may understand that if you delay enrollment in Medicare past age 65, let's say you continue to work until you're age 67, and then you enroll immediately in Medicare, your Part A coverage is automatically retroactively set for 6 months earlier, even if you didn't want that coverage. So you retire in the spring of 2019, you enroll in Medicare immediately, your Medicare Part A coverage is going to go back to the fall of 2018. What does that mean? That means that your final 6 months of HSA eligibility were instantly wiped out. You've lost those 6 months, but you made contributions for those 6 months, not realizing the rule. So now what you'd have to do in mid-2019, when you realize that you weren't HSA eligible after September or October of 2018, you'd now have to go back and refile your income tax return for 2018 because you contributed up to the maximum and you weren't entitled to as a result of the retroactive Medicare Part A enrollment. And then you've got to take some money out of your HSA for 2019 as well because you weren't HSA eligible at any point during 2019. The problem is you can't opt out of the 6-month retro enrollment even if you want to because it harms you financially. So here's a quick example of that. Pretty much goes over what I just talked about. Goober contributes the maximum to his HSA. He retires May 1st, 2020, enrolls immediately in Medicare. But now he's got a situation where he lost his HSA eligibility for November and December of 2019. So now he has to refile his taxes to pay contributed less to his HSA. And now 2020, he's got to pull out money that he put in there thinking that he was HSA eligible up through the end of April. So very difficult situation financially and administratively for people, particularly those who did not want that 6-month retro. So the simple way to fix that is to allow to say the 6-month retro rule is either abolished or it's optional. And an individual can choose when enrolling in Part A whether to have it go back retro 6 months or have it start the day they really need coverage. Currently, there's no legislation that allows this, but we're hoping to see some of that in the next Congress. HSA as retirement accounts. And for those of you who know me or have worked with me, you understand, and those of you who just started from the beginning with us, and I told you the title of my new book, I am passionate about HSAs as retirement accounts. These are absolutely the best retirement accounts you can possibly have as long as you understand how they work and you've got the discipline not to spend the money you put in there for retirement savings. Saving for retirement. The three most common vehicles we have access to are an HSA, a traditional 401k or IRA, and a Roth 401k or IRA. And many of you are participating in 2 or 3 of these. I happen to be involved in all 3 categories for my retirement savings. Let's look at contributions. HSA contributions go in on a pre-tax basis. No FICA taxes, no federal income tax, and no state income tax. Except those of you listening in Alabama, California, or New Jersey, you understand you pay taxes, state taxes on your HSA contributions, but residents of the other 47 states do not. With a traditional 401k or IRA, no federal or state income taxes, but you do pay payroll taxes. Your 7.65% FICA tax is taken out of your retirement contribution. If you have a Roth 401k or a Roth IRA, your contributions are on a post-tax basis. They're after federal and state income taxes and FICA taxes. Balances grow tax-deferred / tax-free in all 3 accounts. When the money comes out, distributions are tax-free from an HSA for qualified expenses. For a traditional 401k or IRA, they're always included in your taxable income. If you have a Roth IRA or a Roth 401k, they're always tax-free. So HSAs are the only vehicle there that has no tax liability as long as you eventually use the money for qualified expenses. This is one of the charts from my book, and I don't go over the 30 or 40 years, but I just show you time-lapse. If you take $3,000 per year and put that into each of these retirement accounts, so you reduce your consumption by $3,000, you pay taxes on those $3,000 if you have to, depending on the account. Here's what happens when you do that for 5 years, 15 years, through 30 years. You can see HSAs are growing faster than the other accounts. So after 30 years, $250,000 in the HSA. In the 401k, $231,000, a little bit less, because remember, no state or federal income taxes on either the HSA or the 401k, but you did have 7.65% taken out of the traditional account for FICA taxes. So it leaves you with a little bit less. If you're in the Roth, you have substantially less because you put in all the money after tax. You deferred your tax benefit until you actually take the money out. So what happens in retirement? Well, the red line shows the HSA. It has the most money, the highest balance in it, and because those balances come out on a pre-tax, they come out tax-free, it's going to last an additional 15 years or so of retirement. So age 30 is when you're retired. The money's going to last 15 years. The blue designates the regular 401k, a balance almost as high as the HSA, but that money goes very quickly because you have to take out extra money each year to pay the taxes that you're due on any distributions from a 401k or an IRA. The Roth starts more slowly and has much less balance, but that money comes out tax-free. So you get less balance than any of them, lasts a little bit longer than the 401k / traditional plan. But the HSA is the superior vehicle here of the 3 because there are no taxes on either the front end or the back end. If you want more information about that, again, my book will be available mid-January. We go through these kind of examples to show you the power of an HSA as a retirement account. Summary. Working seniors can remain enrolled in their employer's HSA program. So working seniors, anybody over the age 65, can remain enrolled in a group plan, can remain enrolled in an HSA qualified medical plan. But if they're enrolled in an HSA qualified medical plan, they may or may not be eligible to contribute and receive contributions into an HSA. If they're enrolled in any part of Medicare, they are disqualified. And the contribution amount is based on the contract size. So again, I point out, if my wife and I are covered on the group plan and she's on Medicare and I'm not, I can still make a family contribution because we have more than one person covered on the contract. Individuals who own an HSA and have contributed to an HSA can always make distributions tax-free for qualified expenses, whether or not they remain HSA eligible. So HSA eligibility impacts only the contribution door. It's either open or it's closed. But as long as there's money in the HSA, distributions for qualified expenses are always tax-free. Social Security and railroad retirement recipients must enroll in Part A. They're always automatically enrolled in Part A and Part B. They can disenroll from Part B with no penalty. They cannot disenroll from Part A. And as soon as they're enrolled in any part of Medicare, they can no longer contribute to an HSA, and their employer can no longer make contributions. Their employer can contribute to every other employee's HSA, but not to theirs. The contribution door has been slammed shut. Employees at small companies may be required by their insurer, not by the federal government, but may be required by their insurer to enroll in Part A and Part B. If they do, then they are no longer HSA eligible. Otherwise, 65-plus-year-olds are not required to enroll in any part of Medicare. The other key point here is if you are a benefit advisor or you are an employer, to understand working seniors need competent guidance to determine the right retirement strategy. As you've seen from the first 45 minutes here, there are a lot of moving parts. And the question is when to retire, when to start taking Social Security, when to enroll in Medicare if you're not required to immediately. What's the impact going to be on 401k, on HSA contributions, on distributions? Excuse me. There are a lot of moving parts here, a lot of things the typical 65-year-old doesn't understand. And it's really important for benefit advisors who want to create a niche for themselves to understand these rules and be able to offer realistic guidance to these employees. It also, for employers, would behoove them to either find that kind of benefits advisor or do what one of my clients did, which is make arrangements with a handful of financial planners in the community. The company, it's actually a college, hires these financial planners, and each employee has an hour of free consultation every year with a financial planner. And I worked very closely with the financial planners on the benefit plans, the premiums, the benefits, HSA and non-HSA. They understand the HSA rules, and they're able to guide employee by employee into which plan is best for them, whether they're under age 65 and Social Security and Medicare aren't in the picture, or whether they're over 65 and now they've got all these other issues coming in. So I found that a very successful strategy. The employees really understood, whether it was a 25-year-old or a 68-year-old, what the implications were of which plan they chose to enroll in. And issues are magnified when people are enrolled in HSA coverage. Again, I mentioned that earlier. All of this last 50 minutes is irrelevant to anybody who's not enrolled in an HSA qualified plan. Because Medicare, Social Security, there is no interaction between them and a medical plan. But there is interaction between Social Security, Medicare, and the account, the HSA itself. And if you don't understand those rules, then the risk is that you make a mistake, and that mistake is going to cost you money. Questions? You are permitted to, there's an app that allows you to send a question. I don't know, Kate, whether we've received any questions yet.
Well, there was a question that, were you making a recording of this? And we're responding yes. And I can follow up with you on the second part of that question after you're finished, if there's any other questions.
Okay. So yeah, very good question. Is this going to be available? The answer is yes, we'll be recording this. We'll also send out slides if you request them. Again, Stewart, WSTUART @benstrat.com. Be happy to send you slides of this, the link as well. It's a lot to absorb in 1 hour and makes sense. People probably need to review it more often, and we do have that opportunity. Kate, any other questions?
Not as yet. Not yet, Bill.
Okay.
I think it's pretty self-explanatory.
All right. So again, WSTUART @benstrat.com. Shoot me an email. If you have put MassAHU at the subject line, that'll help expedite things. Other than that, the Mass Association of Health Underwriters thanks you for participating in this program. We hope you've learned something. Again, the website is www.massahu.org. And we look forward to talking to you about the benefits of membership and other programs in the future we have that are open to the public. Thank you.